5 minutes after 11 o'clock. Thank you for tuning in. Dr. Riadh Fakhoury is in the studio. He is here to answer your questions about your health. And if you were trying to call in early this morning and realized we had phone problems, we can take calls now. So Joe Martone has fixed that little problem, and we invite you to call in. The phone number is the WOCA Climate Control Source Hotline, 622-WOCA. Dr. Riadh Fakhoury is here to answer your questions. Use that phone number. Know this, that he is a chiropractic orthopedist. Those two words, two big words, mean two important and different things. He's also the owner of Fakhoury Medical and Chiropractic Center. And what that means for you is that there's more than one doctor over there. They have all different types of specialties. Dr. Fakhoury has his own set of specialties, and at his medical center and chiropractic center, other people as well. This is the Head to Toe Care Show. We'll give you Dr. Fakhoury's phone number at his office later on the show. Right now, call us here at the station if you want to speak to Dr. Fakhoury. Again, the number 622-WOCA. Good morning, doctor.
Good morning, Larry. How are you?
Good. I do want to pay attention to the three parts of your name. I mean, your two titles, and then the rest of the facility, too. I mean, that really says a lot, doesn't it?
It did, and we changed it back about 3 years ago because for 25 years we were Fakhoury Chiropractic Clinic and served the community through chiropractic care. But musculoskeletal pain, musculoskeletal injuries, they're very complex. So what we did is expanded the facility and expanded the services to be a multidisciplinary clinic, and bringing in medical physicians, bringing physiatrists, bringing rehab, bringing massage therapy. So by doing that, we became the Fakhoury Medical and Chiropractic Center, more of a center to be able to help people with their pain, so that way we have more tools in our tool chest to be able to take care of their problems that they have, whether it's from an acute injury like an accident, or they might have woken up with pain, or like a young gentleman who's 12 years old. He's been in pain with his left shoulder blade, his neck, and his arm for 2 years. So that's a chronic condition.
Yeah, right.
And so with that, we can really do more service in being able to help people more efficiently, get them better faster, and be more cost effective also, and be able to take a more wide array of clients, patients into the office that normally as a chiropractic office we might have not have been able to do, but because we're medical and chiropractic, when that patient comes in and they might have more complexities, having the medical component can help us with that also.
We talk a lot about the things that we do to ourselves. I mean, accidents is one thing, but sleeping wrong is another. Something we can do to maybe stop ourselves from having that. You know, I was speaking to somebody who says that when he goes to get his chiropractic treatments, he no longer wakes up in the morning with like a fuzzy head, or brain fog. He calls it brain fog when he first wakes up. And I said, wow, and I'll have to ask you about that. But, I mean, there must be a connection between our thinking ability and the way we sleep.
And you know, to an extent there is, and you know, and I know we love the chiropractic. Chiropractic works. You've had experience with it. I have also. It's a very effective, natural form of treatment that helps improve the mechanics of the spine. It's very conservative and it's very effective. And so we find that when we're dealing with a neck, there's a lot going on in the neck. You have nerves coming out, going into the arms. You have nerves going into your head. You have blood supply going through the neck, up into the head to serve the head. And so if a vertebrae is out of position, if the mechanics is bad in the neck, if the curvature of the neck is going the wrong way, then that may affect the blood supply going to the head. Could be exacerbated or worsened by using a thick pillow, sleeping in an awkward position, and cause a reduction of blood supply to the head, giving ringing of the ears, giving that sensation of fogginess, giving a headache sensation, giving a dizziness, lightheadedness sensation also. And we find that when we are adjusting the spine, adjusting the neck, getting those vertebrae in a better position, it improves the blood flow, it improves the nerve supply, the lubrication and the movement of the vertebrae is improved, and they start feeling better, sometimes in ways that they don't even mention to us. So indirectly, that gentleman going to his chiropractor might not have mentioned the fogginess in the morning, might have complained of neck pain, but getting the adjustment, a secondary benefit that he received was less fogginess, which means probably improved circulation into the brain, which you and I know is very important.
Yeah, and when you adjust somebody and you hear that popping sound,
yes.
What is the sound?
Well, you know, there's so many different ways we adjust patients. Sometimes when we adjust, you won't hear the popping sound because we'll use a best technique, or we'll use an activator technique, or we'll use a different type of technique, which is we call a non-audible adjustment. In other words, you're not going to hear anything, but we still move the vertebrae where they need to be. Why do we do that? Because some people may do better with a more low force type adjustment. Maybe because of their age. They could be very young, very old. They might have instability of the spine. They might have a disc herniation. So we have in our bag of treatments different types of modalities. So our chiropractic care can be so gentle that we can align the spine, get the person feeling better, but at the same time, they won't hear that popping noise, or what we call cavitation. Others, when we manually manipulate the neck and realign the vertebrae, there's sometimes that sound, that cavitation, that release, that opening, which is very healthy done correctly, because it will pull the fluids into the area and improve the mechanics and make it work better.
Oh, really?
Yes, and really they don't know what makes that sound, but they feel it's like a suction effect or vacuum effect, because there's fluids in there. And when you open it, you pull fluids in there, and it brings nutrition to that area that needs it most. And it's very healthy.
No wonder it feels good.
It does. Now, you have to be careful with those people, because you might have friends and family or coworkers that you know that might be
Do it themselves
and popping their neck.
Yeah.
And you know what? It feels good. But the problem is that they're moving the wrong vertebrae, because they can't, number one, they don't really know the right vertebrae that's stuck, number one. And number two, because they're self-adjusting themselves, grabbing, under the chin and the top of the head. And
I can't even imagine doing it.
Turn it one way, turn it the other way. So they get relief because there's been a release of endorphins or pain relievers because of the movement of the bones. However, they're moving the wrong one. And when you move the wrong one, you make your neck unstable. And you find that you have to pop your neck regularly, maybe 2-3 times a day, and it becomes unstable. And then any time that the vertebrae moves too much, it's going to wear out faster, and you're going to get accelerated arthritis. So they're, in the long run, feeling some relief temporarily, but causing more instability and problems in their neck, which is going to really cause harm in the future. As opposed to when you come to the Fakhoury Medical Chiropractic Center, when we do the chiropractic treatment, we as chiropractors are trained to move the bone that's stuck, not the one that's moving too much, get it back in a proper position, improve the mechanics, start stabilizing the spine, and that 1 day of relief becomes 3 days, becomes 1 week, becomes 2 weeks, becomes a month, and longer from there. So instead of having to pop your neck more often, which is what happens when you try to self-adjust, making your neck unstable, at the chiropractic treatment, we are actually making it more stable, so that way the adjustments hold longer, the mechanics is better, the blood supply to the head is better, the nerve supply to the fingertips is better, and you're healing and recovering.
Is it the same? Is the sound we hear when we pop our neck, or when you pop our neck, the same as when we pop our knuckles?
Yeah, and
same thing.
And the word that we like to use when it's a chiropractic treatment is an adjustment. So adjustment, mobilization, manipulation, those are common words that we use, because I would almost say when somebody pops their neck, pops their finger, it's sort of an uncontrolled, just a general movement, looking for some relief without any real goal in mind, or direction, or specific force that's being applied on a certain unit that's trying to move it to the right position.
Right.
So if you're popping something, like, for example, you can crunch your finger and make it pop, but by doing that, what you've done is you've rubbed the surfaces of the joint together, and that rubs the lining, or the membrane on those bones that produces fluid and keeps the bones separated, so they, like a Teflon coating, slide on each other. You start rubbing that off, then what happens is the bones have rough edges, and the arthritis starts to set in.
Oh, in the hands too.
In the fingers, and you start
wow.
wearing off the lining on the bone that produces the fluid that keeps the lubrication. Less fluid, less lubrication, more stiffness, more arthritis. It becomes a vicious cycle. So, but to go and say, to answer your question, the mechanism of that sound that you hear is very similar to an adjustment also, because what you're doing is a vacuum release where you're opening the space, getting the fluids into that area. But the difference is, one is more like a controlled movement of a certain specific area that's a problem. The other one is just like a general movement that can cause some damage.
And is it always, I mean, when it's done properly, when it's done under a doctor's care, is it always done as a treatment for some injury, or is it done as a prevention of something?
A prevention, we're seeing more people doing it for prevention.
Uh-huh.
So Larry, like for example, I have a medical provider that came in today before coming over here. He's not in pain, but he knows his body's just not lined up where it needs to be. The vertebrae in his back being out, the pelvis being out, the neck being out, not far enough to cause pain, but knowing that if it's out of alignment a little bit, little by little it'll cause damage, and it's all cumulative, and over years it'll take its toll. So he likes to come in every 3 or 4 weeks just for a maintenance or wellness adjustment to get the vertebrae back in optimum position. Even if he's not having pain, it's better that it's working properly, so that way it lasts longer. For example, if you have a tire that's slightly out of alignment, so minimal that you don't notice it, but over tens of thousands of miles, it'll shorten the life of that tire, and it'll start showing up later on. So what he likes to do is more of a maintenance of realigning that tire to get the better tread, so knowing that because of the nature of his work, it's going to start, and previous injuries, it's going to work itself out of alignment. Before he feels the pain, he wants to get it back into place, so in the long run, he'll do better.
You know, a mechanic told me that it's sometimes better to align a car when the person who's going to be driving it the most is in it, because the weight of that person actually affects whatever they're doing with that.
Isn't that interesting?
So that must apply to the human body, too. I mean,
Well,
if we're heavier and decide to lose weight, then your role as our doctor must be to change something. Am I right about that?
You know, and that's how the philosophy that we look when we take our x-rays, because most people who are listening have had x-rays, but they lay on the table.
Yeah.
When you lay supine or on your back, there's no gravity effect, there's no pressure on your spine. So when we take an x-ray in the office, we have the person standing up, so that way we can see the pelvis, the alignment, we can see the function, the biomechanics of the back, because when you're lying down, you may have a straight spine, but when you stand, you may have a strong curvature, which is very important in our understanding how the body works, because when we do our line of drives or our direction of force to realign the vertebrae, whether it's with an activator or blocks or the best technique or a manual adjustment, and there's multiple different types of manual adjustment that we do at the office depending on the patient's needs, we know where our forces need to be most effective to get the optimum realignment of the spine.
And so do you have people coming in for an alignment or for an adjustment prior to like a long road trip or something where they're going to be in that awkward sitting position for longer than usual?
More people need to do it, but most people that are thinking that way are the snowbirds. When they come down, they'll come in after they unpack and come in for an adjustment to realign the spine.
After the drive.
And after the drive, and then just before they leave, they'll come in for an alignment also, knowing they have a long trip ahead of them, so that way they don't get, somewhere in Tennessee and start having some pain or problems. So they like to put some insurance in that their spine is in a better position, so they'll have less problems.
That makes a lot of sense. I mean, if you're going to be sitting for a long time, it's not always comfortable.
Right, and the other person is the athlete. The athletes come in, of course they come in when they have their injuries, their ankle injuries, their back injuries, but we have many athletes that come in saying, I want optimum performance from my spine. I want everything lined up so I have less pressure on my spine, less pressure on the nerve, and I can function better. And so our adjustment of the athlete, we have some amazing athletes that come into the office, and they come in for an alignment to perform better. They golf better, they play tennis better, they run better, they do gymnastics better, and that's why you'll see so many professional athletes having their chiropractor with them, because it improves and enhances their ability to perform, reduces wear and tear because of improved alignment, and also reduces the chances of injury because they're in a better alignment, so they're more in the green zone than the yellow or red zone where there's pressure on the body that just a little extra will cause an injury.
By the way, Dr. Fakhoury is available for your questions if you would like to call him and you're resisting or reluctant because the phone was not working earlier. It is working right now. Joe Martone fixed it. The WOCA Climate Control Source hotline is 622-9622 if you would like to speak to Dr. Fakhoury. When you go for a maintenance or preventive visit, It seems like it's always about the back and the neck. Do you ever work on the knees in a preventive maintenance?
Definitely,
Yeah.
yes. And many of the patients will adjust their ankle, their knee, their elbow, their wrist. There was a gentleman yesterday, he didn't realize that we treated the extremity, and he complained of his wrist. And one of the bones, there's 8 bones in the wrist, one of them was out of position and causing an irritation. So with a very specific adjustment, it just set right in position beautifully, and that I know will make a big difference.
Oh,
for him.
really?
Yes.
And what was going on? He had pain or numbness?
He had pain in the wrist.
Oh, okay.
Right where the thumb, just behind the thumb. And again, that's where communication between the patient and the doctor is very important. And we stress communication. Sometimes you'll go into offices and they don't really want to hear too much. They're in, they're out. Really, that's not the right service. What you need to have is your physician listening to you, answering questions. You want to be able to talk about those things, like giving enough time for the patient to realize, by the way, I've been having ringing of the ears. I haven't mentioned it before, but is there anything that you can do? And that's where we can talk about the different causes of a specific problem to be able to pinpoint if there's a treatment for it.
Now, is that the same ringing that an ear doctor would refer to as tinnitus or tinnitus? I've heard it said both ways.
Yes.
Yeah?
Yes, it is.
So there's actually something you can do for that.
There are so many causes for tinnitus. And again, our team approach at the Fakhoury Medical and Chiropractic Center is very good because we have the medical and we have the chiropractic. And so if Dr. Shanawani, our medical physician, finds that it could be something more on the medical side, it could be blood pressure, it could be an inner ear problem, it could be vascular. Sometimes the blood vessel is close to the ear and you actually hear the whooshing of the blood vessel in the ear. It could be a possible tumor. So Dr. Shanawani at that point will refer the patient to, there's an auditory nerve tumor, which one of the symptoms is that. There's a triad called Meniere's disease, which includes the tinnitus also. So we have to look at that and address that. And Dr. Shanawani, with his experience, will refer that patient to their primary care physician or to a specialist to evaluate that fully. Again, our focus at the office is musculoskeletal care, from the medical to the chiropractic to the rehab. However, if we see something that is more than that or different than that, we'll team up with that patient's primary care physician or refer them to the right individual who can help with that.
And I think what I'm making a connection with, based on other conversations we've had, is that I'm guessing patients wouldn't think to ask a chiropractor about tinnitus or about pain in their jaw or what they perceive as their teeth.
There you go. And that's why the communication and the comfort for the patient to feel comfortable enough to ask these things, to discuss these things, it's important. And that's the environment that we try to set the Fakhoury Medical and Chiropractic Center for that patient to be able to say, hey, by the way, this is happening. What can I do about it? And then we look into our array and see if it's something that we could take care of within the office or outside at that point. Going back to tinnitus, another cause for tinnitus could be the atlas or the first vertebrae in the neck, right under the skull, could be out of position. That vertebrae, when it's out, very often causes headaches at the base of the skull, behind the eye, the nausea. Very easy to take care of those symptoms. And at times, when we adjust the atlas, a secondary relief and improvement is the tinnitus. Other things that cause tinnitus is taking too much aspirin. So there's
really?
There's hundreds of causes.
What is the? I'm sorry, I didn't mean to stop it. What is the itis? What is? A lot of words have like tendinitis is another itis. Is it the same? Does the suffix mean the same thing?
Yeah. There's costochondritis. There's arthritis. There's osteoarthritis.
Right.
There's discitis. Itis means inflammation. So if we say disc-itis, the disc is the cushion between the bone that allows separation and movement of the spine and keeps the bones apart for the nerve to be able to exit and go down the arms and leg. When that disc is inflamed, it's called disc-itis. When you have tendinitis, the tendon is inflamed and causes pain with motion. When you have bursitis, bursa or sac, that sac is inflamed and enlarged and putting pressure on the surrounding tissues, causing pain.
And I know this is like Dr. 101, but what is osis?
Osis?
You know, when you have like scoliosis or something like that, what does osis mean?
Well, let's get the book out. Let's Google that. Okay.
Oh, really? Am I saying the word? What is the curvature of the spine? What is that called?
Well, curvature of spine is scoliosis.
Osis, okay.
And the breakdown of that, you and I will have to look at it together. We know that scoliosis is a curvature of the spine, where when you look at somebody's back, it'll have a bowing effect or a curve, and usually one shoulder higher than the other. But the actual breakdown of the word scoliosis, we'll have to look it up to see.
I didn't mean to throw you a curveball.
No, that's okay. Instead of just throwing out an answer, we should make sure it's correct.
If you have any of the above, whether you know what the suffix is or not, if it's hurting you, you know. And I think maybe knowing that it's inflamed as opposed to infected, it's two different things.
Big difference. Big difference. An infection is where you can have damage occurring to the structures, because an infection is a fighting process of the body, and it can spread and cause damage to surrounding areas. It's very important to take care of that and to address that, and that's part of the team approach again at the Fakhoury Medical and Chiropractic Center. Is when a patient comes in, they may need only chiropractic, or they may have such a problem that we have to pull the medical component in at the same time and team together, almost like going to the Mayo Clinic and you have several different specialties in one location, that at the same time you could see several different people simultaneously. They put their thoughts together and communicate together with each other to come back with the best answer for the patient and the best course of treatment for the patient. And that's something that's unique to the Fakhoury Medical and Chiropractic Center that is helpful, because sometimes there's complexities with pain, and pulling several, having the 4 chiropractors, having the several medical doctors coming together and brainstorming a patient's scenario, we can put a good plan together for them.
Yeah, and if you're doing it for preventive purposes or to stop a pain that you've been having for 3 days or more, it's always a good thing to go to the doctor.
It is, and the sooner the better. For example, this young man that's been in pain for 2 years, a lot of that is because, and this could be somebody's grandchild, it could be somebody's son, and the problem is that the parents or the grandparents don't really know what to do. Is just child complaining just to complain? Did they see somebody else? Maybe they don't want to do this or do that. So you don't really know the source or the cause of the problem, but so it could linger longer. But if the complaints are continuing more than several days, then it's a good idea to get it checked and evaluated. And sometimes the treatment is so simple, and the cause of the pain, which could last years, is very simple and can effectively be treated within just a couple of visits.
Do you ever, I guess, not authorize, but recommend like an exercise program to actually help with somebody's muscles and bones?
Definitely,
and all that? Yeah?
Definitely, and that's part of the component of the rehab. And sometimes a patient may not need rehab, so they're coming in for just an adjustment only.
Yeah.
However, their posture is poor, or they need to develop their core. So what we do at that point is we just send them over to Brady, Travis, Tyler in our rehab department. Have them just spend a few minutes with the patient, give them some handouts, give them a few exercises they do. Sometimes in the room, the physicians will do that. Sometimes the massage therapist will do that. But it's very important to take very brief exercises or stretches that only take maybe 30 seconds to a minute to do, that can have a dramatic effect on that person's well-being.
Yeah, and getting back to the first part where we're cracking our own necks and cracking our own
knuckles. Oh my
knuckles
goodness, I'm cringing. If you don't see me on video, I'm cringing.
Well, Dan does this all the time, and I don't know. But yesterday was his birthday. Did you know that?
I wished him happy birthday.
So
yes,
we hope that he stops that. That way he can.
That's right.
Get to be an older person.
At 21, he needs to stop doing that. That's right.
Now sometimes I can straighten out my arm and I can hear my elbow pop.
If it happens on its own, like, we're in bed and we get up and the first step our knee pops here and we pop here.
Right.
That's okay if it's spontaneous. But if you are stretching your neck to the point that it pops and you say, well, I really didn't do that, but you did because you were stretching it to the point, then you have instability. And there's a reason you're doing that, because there's discomfort, there's a problem there. And it's best to come to a professional that knows how to address that. Leave the area that's unstable alone, go to the problem area, strengthen that so the instability passes and that person will not feel the need to have to pop their neck anymore.
Do you know, I think I've recommended this before to other people, but I think do you have a magnet business card for the refrigerator?
I do not.
Because you know what's very popular now is a lot of these extreme sports.
Yes.
So can you imagine the mom or the dad, hey mom, I'm going to go skydiving today or whatever, and you got these this is big fad now to do things to the extreme.
People push themselves to the limit.
Next thing you know, they're going to say, what was that guy's number?
And we see a lot of those folks coming in, actually owners of those types of facilities, because not only are they doing it themselves and staying in fit and competition, but at the same time they have to do it more regularly because they have clients that are coming in that they have to actually work out with and do these extreme sports with. So they put a lot of stress on their body. So doing the treatment, again, they come quite often. They're coming in for wellness care, maintenance care, so that way they don't injure themselves.
What was your sport of choice when you, well, maybe even now, not just when you were younger, but let me guess, basketball?
No. Swimming.
Oh, you're still swimming? Uh-huh.
Bicycling, walking, and running.
Okay. Were you like in the track team in school?
I was on the track team.
Yeah?
Yes.
Yeah.
Yes. Not the best, but I was on the track team.
Yeah, but you ran. We went to the Silver River State Park the other day, and we walked. There's a sinkhole that it's been in the news. It's not a dangerous one, but it's a natural one, whatever. They're all natural. Anyway, it's a 2.2 mile walk to get to the thing, and you get there, and to be honest with you, there's nothing there. It's just a little indentation in the ground. It's like, oh, I walked all this way, but then I said to Robbie, you know what? I kind of enjoyed the walk.
It's fun, isn't it?
Yeah.
Once you get out and walk, and what I recommend to people who've just been sitting and they say, I really need to start exercising, I tell them, just do 5 minutes a day.
Just a little bit,
5 minutes a day. Maybe march in place for 5 minutes. It's good for your bones. It's good for your muscles. It's good to lubricate the joints, get yourself moving, even if you walk in place 5 minutes, because that will catch, and 5 minutes will become 10 minutes. So starting somewhere is better than not at all.
So if you're gonna start walking, is for your role in our lives when it comes to that. If you get hurt, you know where to go. But maybe before that is to go, and maybe you could recommend a shoe. Maybe you could recommend some kind of a way to prepare. Rob made a good point. She said, "This is so wonderful. Why do people buy those expensive treadmills?"
It's true. It's we can do it on our own. So and it's interesting things come in at the same time also, in that when somebody comes in, like we had one patient coming in yesterday saying she's had heel pain. Well, in that scenario, we've talked about plantar fasciitis in the past and the pain in the bottom of the foot. Interestingly enough, pain was in the back of the heel, which is very unusual. And so, again, if you find that she had it for years. So if you're in a situation that you're finding that you're having some discomfort, some problem, aside from just waiting it out and thinking it'll go away, which it usually doesn't, it's better to address it, get somewhere, get it looked at, get some answers, and make sure you get it taken care of.
Wow. Now we need to get your phone number. Now that we're at the end of the show, what is your phone number?
The number is 351-3413, and if you press 4, it takes you directly to the front desk, and to Amy, our patient care coordinator, and the ladies will be available for you in any way possible, answer any questions and assist you. Yep.
As we're getting ready, this is the time of year people want to get out and start moving around and doing things, and we've got so many great trails in our area.
That's right.
Just explore all of them. Make a map. Say, I went to this one. I went to that one.
That's right. And the best medicine is preventive medicine.
You're great, doctor. Thank you so much.
Thank you, Larry. Thank you.
We'll take a little break and we'll be right back.
Do you wonder why you continue to experience pain? Is your daily routine affected by your body telling you that it hurts? Let us explain why this may be happening to you every Wednesday at 11 a.m. on the Head to Toe Care Show. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center, available to serve you and answer any questions that you may have. Again, that's on the Head to Toe Care Show every Wednesday at 11 a.m. right here on WOCA, The Source.
Ocala's information station, 1370 WOCA.
Ocala. The weather is brought to you by MyFW.